Hello, everybody. I'm going to wait just a minute or so just to make sure everybody is in totally with their audio at the very least. While I wait, I can't help but say hello to Siegfried Othmer. It's very, very nice to see Siegfried. Very, very nice. Okay, for those of you who do not know me, I am Mitch Sadar. I'm the president of the board of the Northeast Region Biofeedback Society. And on behalf of the board, I want to welcome you and to say thank you for being here. We appreciate your interest. This is a part of our sponsor series. I will introduce our speaker shortly, but before that, I just want to make you aware there are some other things that NRBS is offering. There's a CE series for which you can get 8 CEs, and you can get those whether you watch the presentation live or a recording. We are offering some special deals if you are not a member. We are going to offer that you can join our society midway through the year for $75, and I would ask if you are not a member to consider that, because your membership allows us to offer the various things we are offering. There's also a deal. These things will be in detail in the chat. There is a deal where you can get last year's CE series and this year's at a special price. I also want to mention that the NRBS Fall Conference will be held in November, the 1st, the 2nd, and then the 3rd. It'll be outside Philadelphia at a beautiful retreat center, and I think it's a thing everybody should really check out. I think we are looking forward to all of our speakers, but we are looking forward as well for the people that had attended in person. There will be a bunch of extra conference activities, and I think it's going to be a lot of fun. Okay, enough about that. I want to introduce Santiago Brand. He is presenting tonight for the biomedical. I want to put in a plug for biomedical. If you folks are not using them for your neurofeedback and biofeedback supplies and equipment, you should really check them out. Brian and his crew are very, very helpful people. They support our field, and we should, try to return the favor. I'm going to just mention while I'm thinking of it, as Santiago speaks, if you have is please put them in the chat where they will be collated, and at the end there will be time to look at those. All right. Santiago Brand is a clinical and sports psychologist. He's board certified in QEEG, biofeedback, neurofeedback, HRV. He is the founder of Mind Lab Neuroscience Consulting in Singapore. He has lived around the world. He has been interviewed by multiple media, outlets like CNN, for example. He is currently a consultant for the Bolivian Football Federation, the Guatemala Olympic Committee, and the Taiwanese Association for Biofeedback and NEUROFEEDBAck. I was recently at the Biofeedback Federation of Europe conference, and at that conference, he was awarded commendation for his service to the field of neurofeedback and biofeedback. He is out there spreading the word worldwide, which we really appreciate. So without further ado, I already said that. Without further ado, I will turn it over to Santiago. Thank you, sir.
Hello, everybody. Thank you, Mitch, for the kind words and the introduction. It's an honor and a pleasure for me to be here again for the second time, speaking about neurofeedback and biofeedback and QEEG for trauma and PTSD. And it's good to see familiar faces and some new faces. And today what I will do is start with a short recap of what we spoke about in the last webinar. And then I will switch presentations briefly and go over some specific slides on why we want to use biofeedback, specifically heart rate variability, and why we want to use neurofeedback for trauma. And then for those of you who are interested, we're also promoting, suggesting that you register for some of the trainings that I'm going to be doing in Texas in September. We didn't mind out for you, for those of you who are interested in incorporating either QEEG, biofeedback, neurofeedback, or all three modalities with your work as a mental health practitioner, as a therapist, or whatever your scope of practice is. Last time I started making an introduction on why we study trauma, why it is important to talk about trauma. And if I recall correctly, one of the first things I said, or the first thing I said, is that trauma is part of essentially everyone's life. Most of the clients you're going to work with, or you have worked with, will have some form of trauma history, will have a form of presenting that trauma response, and some of them will meet the diagnostic criteria for PTSD. And there's more and more evidence now that neurofeedback is an excellent option. It's a great option for the intervention and stabilization and optimization of brainwave patterns and brain activity to help individuals heal from trauma and the other comorbid conditions that may stem from trauma response. And so I mention always the CDC, the Kaiser Permanente study, which I think is very important because it speaks to the medical byproducts of the trauma response. And I think this is the first time that medical doctors took a serious and deep look at trauma and how it ends up affecting individuals from a medical perspective and consequently also from a mental health perspective. So I think this, referring to this study, is still valid, still relevant. And I also mentioned the different dimensions of trauma based on what the study came up with that affect people, and that these dimensions we need to address when we are doing interventions with individuals. We consider them as part of the conditions and the dynamics that we're going to treat, or we're going to train rather, with neurofeedback, with biofeedback. One of them being abuse, and divided into emotional, physical, and sexual abuse. Household challenges, that's another important one. Neglect. And we talked about this pyramid, and I said that for the most part, when the client comes to see us, they are going to already have experienced the trauma. They already would have gone through the adverse childhood experiences, and they already would have experienced the disruption in their neurodevelopment. So the individual is born, trauma or traumas take place, the individual is not the same, they come see us, and then we are here at the top of the pyramid where they are adopting risky behaviors. They are addicted to illegal substances, they are promiscuous, they are associating with the wrong people. They have spent many times in the justice system. And so what we do is we look and see how much we can help in terms of, again, stabilizing and optimizing brain health and brain activity through the different forms of intervention that we use. And there's also a list of behavioral and emotional consequences to trauma. And we're going to be seeing a lot of them in the clients that we work with. We're going to end up intervening on some of them too, because these are the byproducts of the trauma, but they're also what exacerbate the trauma response in many ways. So it's a closed loop, bidirectional relationship between the trauma and its consequences. And that's what we end up helping with. And we also spoke about some individuals being exposed to trauma, but not everybody who's exposed to trauma or experiences trauma or witnesses trauma ends up being traumatized, ends up experiencing the same response in the same way. And we need to understand why. These are elements that are very important to consider in our interventions. The first thing is, how long is the trauma or the event lasting? How long does it last? The longer it goes, the more the unhealthier it is for the individual, the more dangerous it is for the individual. And we need to consider that. Are we working with a individual who's currently undergoing trauma, who's going into a toxic environment, who's going into who's experiencing toxic stimulation? And that is something we need to take into account. What's the context of the person's life? What's their family like? Do they have a good social and emotional support system? Do they have a good environment that provides a nourishing stimulation for them? And so we need to take this into account if we want to really become more successful. What are the physical characteristics of the individual? Are they able to move and escape? Are they handicapped in some way, which prevents them from escaping or getting away from this traumatic environments or these toxic environments? And their learned capabilities. What was the upbringing like? And how does that upbringing influence their coping strategies and the way they deal with the trauma? Because all of this plays into the interrupted neurodevelopment, the dysregulated development that the person experiences. So again, we spoke about that. And very important here to recap, to take into account, is the 4 components of the trauma response. And this is based out of Peter Levine's book, Waking the Tiger. Every time a client comes to work with you, they're going to experience very likely all 4 of these components. Some are going to be more salient than the others. For some people, hyperarousal will be the most salient presentation. For some people, it would be the constriction or the suppression of the emotions. They don't think there's anything wrong with them. They live in denial, or they just don't feel that there's anything wrong with them, that the trauma took place, but they were able to survive it, and now they have moved forward, even though the emotional symptomatology or the psychological symptomatology or the physiological symptomatology is quite evident. Then For some will be dissociation, and for some will be more in terms of freezing, more commonly referred as helplessness. And helplessness is when the client will come and say, you know what, there's nothing anybody can do for me. I'm about to give up on this. I've tried a lot of things and nothing seems to help me. So again, clients will present with characteristics of these four. One or two would be more salient for them. And we can pick up traces of this in the EEG, in the QEEG, and during the sessions where we do neurofeedback. So we learn to neuromodulate the neurophysiological byproducts of these components of the trauma response in order to stabilize them, in order to help the client heal from trauma. And there are some physiological symptoms to this for hyperarousal, for suppression, for dissociation, and for helplessness. And we understand them, we work with them, we work dynamically with them during the sessions. We ask the client to work with them dynamically in between sessions. And as a team that we form with the client and their families, we target the trauma and we seek resolution to it. And so to do that, we can look at psychophysiological signals. We look at how the body and the brain respond to events in the person's life. What's their heart rate like? What is it doing? Is it healthy and regulated? Is it unhealthy? Is it predisposing somebody to worse or more serious medical and emotional conditions? We can look at skin conductance, which is the sweating response, and we can also gather a wealth of information on the clients responding to trauma based on that, and we can train to optimize it so people can cope more robustly against trauma symptoms. The same we do for temperature, skin conductance and temperature being the two best psychophysiological indicators of somebody's psychological and emotional vulnerability to stress. And in this case, the stress that is associated to the trauma. We can look at the respiration rate. We can train and optimize and improve that respiration rate. And of course, with neurofeedback, we look at EEG activity, either by using different analysis to QEEG or doing 19 channels full cap EEG. And the important thing is we want to help the client understand why. You're depressed. Okay, let us help you understand why you're depressed. Where is it in your brain? Where is it in your body? You're feeling anxious. You cannot sleep well. You're still having flashbacks. You cannot stop your emotional eating. Let us help you understand where it is happening and how exactly it is manifesting for you. And to me, the greatest added value of the work that we do here is precisely that we can help the client understand the why, exactly where it's coming from in the brain and how it is interacting with other elements in that person's life, and then how we can put this info together and then start training it and optimizing it so we can empower the individual and help them heal. And of course, when we do this, we're involving a psychological component and a physiological component. What are the mental schemas the client brings into the office when they come see us for the first time, when they come for the assessment, when they come for the interview, when they come interested in neurofeedback and they're asking about our services? And then there's also the physiological. How is their body responding? How is their brain responding? How dysregulated is this system and how we can regulate it again? And the combination of these two elements is what we end up working with. We optimize it through the work we do directly with the technology, but also in the work that other individuals can bring into the equation. And by that, I mean psychotherapy, functional medicine, physical therapy, psychiatry, medication. So we work in tandem and as a team with other professionals to bring about a specific result. And so I will speak about how reliability in more detail in the next set of slides. But essentially, when we're working with trauma, we need to work with the heart-brain connection, the heart-brain interaction. That's very important because now through more research, it is known that the heart has a complex nervous system. Some people call it the heart's brain. Some people say the heart has its own brain. Whatever you decide to call it or whatever school of thought you follow, the important thing to understand here is that the heart also produces very interesting and useful information and can be trained to optimize brain activity. So through training the heart with heart rate variability biofeedback, we can have an important and strong impact on the brain, and that can help facilitate this healing process. And I will mention a couple of things with EEG, but here is an important component. This is an individual who was presenting new brainwaves, and new brainwaves are sometimes associated with dissociation in traumatized individuals, in individuals who have experienced trauma response or PTSD symptoms. And here we have to the left the mu quite synchronous. This is an individual who experienced trauma and tends to dissociate. And once we start doing heart rate variability biofeedback, we break that dissociation pattern, we desynchronize the mu, and we help just by engaging in coherent, deep, and slow breathing for a few minutes. And if we repeat this over time, we can create and generate and foster this plasticity. We can foster this new connectivity in the brain that, when combined with the skill set to survive outside in the world and survive efficiently and live your life fully, becomes more efficient. And again, we also use temperature training and galvanic skin response or skin conductance training. And what we're doing is showing the individual how their body's responding to whatever's happened to them. And we can train this in a variety of modalities or scenarios. We can do it through videos, through video games, through music, through audio, through vibration. The essential element here is that people respond to that, and they respond to it efficiently. That we can optimize the plasticity, that we can optimize the physiological responding. And now the person has a way of coping with the symptoms, mitigating them, managing them more effectively, and also have a sense of when they're coming so they can interrupt the process. I won't stop here on neurofeedback, but I want to show a couple of EEGs here to recap. And so we have this is an individual with neurofeedback. With the main presentation was this T4 insula presentation with a high amplitude alpha peak. And when he was impacting the insula, it was making him more reactive, more aggressive, more depressed. And that was his main complaint. I'm very aggressive. I'm very short-tempered. I'm triggered very easily. I go into the destroying things. I punch the walls, and I'm out of control. And this is after 13 sessions of neurofeedback. This is not even a full course of 40, 60, 80 sessions of neurofeedback. But after 13 sessions, there's a very important reduction in the activity. So in some degree of short-term training, this individual is showing that his brain is becoming more stable. And if the brain's becoming more stable and we teach him anger management skills, then he's going to behave differently. So this is a new version of this individual. Of course, an individual is never the same after the trauma, but they can optimize the version of who they are, and they can create a new version of themselves, a healthier, happier, more functional version of themselves. So that's the recap. I'm going to switch gears here, and I want to talk about heart rate variability because I think is one of the most powerful interventions that we can use for trauma. Here we are. So why do we want to use heart rate variability? Well, we want to use it because, as I said, there's research that shows the connectivity and the relations, the dynamic relations and interactions between the heart and the brain. And it turns out that when you optimize heart activity, you are also optimizing brain activity. In my experience, the first thing I normally teach people, regardless of their age, is to do optimal breathing and to strengthen their heart rate variability, regardless of their age and regardless of the condition. In my years of doing clinical work, when I was doing clinical work, I would start with 6 years of age. And normally people would think that a 6-year-old child or younger cannot learn to do biofeedback and cannot learn to do heart rate variability, but it turns out they can. And even with neurofeedback, toddlers can learn to regulate their brain activity very efficiently. This is a modality that is easy to learn, and people usually learn how to optimize their heart rate variability in as little as 3 sessions, which means they're already having a head start on their healing process. And so along with heart rate variability, we can also combine it with the other biofeedback modalities. We can use it in tandem with respiration, with EEG, with neurofeedback, with skin conductors. We can work on it individually, but we can also combine it. And in my experience, it is always more productive and more beneficial to the client if we learn to combine these interventions. Not only combining the psychophysiology and the neurophysiology, but also combining the skills that they learn through psychotherapy, through hypnosis, through coaching. So if we take the skills that the person is learning outside of their psychophysiology and we involve the psychophysiology, normally the prognosis is much better for this individual. And when we study heart rate variability, we're starting what the heart is doing. We're looking at the heart rate, we're looking at the heartbeats, and we're understanding what they tell us. What's the neurological, the neurophysiological purpose of the heart? When the heart beats in a specific way, it sends a message. If the heart is dysregulated, it sends the wrong message. Just like when the brain is dysregulated, it sends the wrong message. And when you get the wrong message, your behaviors, your emotions are out of order. We bring order to the physiology, to bring order to the behavior, to bring order into the cognition, to bring order into the emotion. And that's what we can do by studying the heartbeat intervals and the spectral displays, just like we would do with EEG and neurofeedback. And by understanding this, we can now teach the individual specific techniques that they can learn to use during session hours, during office hours, and that hopefully they practice in between sessions. One of the important things to understand about neurofeedback and biofeedback is that there needs to be practice. We need to assign the client homework, easy to do homework that they will engage in and perform in between sessions to enhance the conditioning, enhance the plasticity. And so obviously there's ongoing research. Heart rate variability is one of those psychophysiological modalities that has tons of research into mental health and physical health and emotional health. So there's no shortage of research when it comes to heart rate variability. And more people are combining heart rate variability with EEG work to see how training heart rate variability impacts the brain. And we'll see a couple of slides on that. Now, just like neurofeedback, heart rate variability is all about self-regulation. What do we want to build in the individual? What do we want to strengthen in the individual? That's self-regulation. That capacity for the body and the brain to self-regulate even in critical moments. As a sports psychologist, normally I train athletes, and when I teach the skills, I train it for critical moments during competition. You know, you're gonna have that free throw with 10 seconds to win the game or send the game into extra time. You're pitching the 9th inning to close the World Series. You're shooting that penalty kick in soccer to win the World Cup. That's when the athlete needs the skills the most. But with clinical patients, with, quote unquote, normal individuals, regular people, well, we want to train them for critical moments in life. I have a meeting with my boss, and my boss is always berating me. How do I self-regulate? I'm going for a job interview. How do I self-regulate? I just finished a tour in Afghanistan and Iraq, and I'm ready for a second tour. How do I prepare myself for that? I came back from the war and I have nowhere to go, and I'm now doing neurofeedback. How can I help to self-regulate, to heal from the PTSD I experienced while I was in combat? So in a variety of settings, what we want to teach is the self-regulation, and we specifically want to teach it in critical moments. It's very easy to do this when things are going well. A different thing is when you experience the stress and the world sort of turns against you. That's when you need to learn the skill. That's when you need to enhance it. And my recommendation for upcoming therapists when I do my classes is this: you have to train your clients with some degree of stress in control situations, working within their window of tolerance, so that you can now have a better understanding of how they react, and they can have a better understanding of how they react. What are the benefits of biofeedback? One of them is stress reduction. Of course, we want to mitigate stress. We don't want to eliminate stress, but we want to mitigate it enough so that the client works with the self-regulation and they can have a normal, a life as possible, an adaptive life, a happy life. With all the uncertainty in the world, with all the stress that goes there, they can have more resilience against these conditions. Medically, there's evidence that points to improved cardiovascular health. And if there is improved cardiovascular health, there is improved physical health, and there is improved mental health. So if not for the benefits of mental health, we're doing it for the benefits of physical health. I have worked with cardiologists here in Singapore who send me clients who've had with different heart conditions. We do heart rate variability, and there's great improvements. And the cardiologists are pleasantly surprised and pleasantly happy. And sometimes these individuals have secondary gains that they were not expecting just because they were not consulting for that. Their sleep gets better, their anxiety is reduced, their flashbacks and their nightmares are greatly reduced or eliminated. So we can do a lot of things when we look at the comorbidities. We, again, optimize sleep. We can enhance athletic performance. And this is something that athletes use today. The USOC does it, the Canadian Olympic Committee does it. I've trained the Guatemalan Olympic Committee and the Colombian Olympic Committee, and they do it as well. There is improved emotional regulation. To me, that's one of the greatest benefits of heart rate variability. Because emotional dysregulation is one of the hallmarks of trauma and PTSD. The individual is highly aggressive, is highly dissociated, is suppressing his emotions, is not sleeping well, it's highly triggered. And when we can optimize that, we can change the individual's life in the course of a few weeks. Obviously, there's reduced symptoms of depression, whether the depression is related to the trauma, whether the relation is caused by a traumatic brain injury, whether the depression is a dysregulation in the EEG because there's maybe a spike in wave activity that is not causing seizures, but is dysregulating the amygdala and the emotional centers in the limbic system, in the frontal cortex. And we optimize cognitive function. A traumatized individual will have all of this. They will have poor cardiac health. They will have poor cognitive performance. They will come with nightmares. And through heart rate variability, we can provide it with a first line of defense against all of this. It's a very cost-effective, a very cost-efficient modality. People can learn to do it in very few sessions. With just a few minutes of practice every day, it can make a tremendous difference. So there's more to it. We can also work with anxiety. We can also help with hypertension. We can help with insomnia. And again, we're working with the connection and the relation between the heart and the brain. And we can measure this now with the technology available. We can take a simple but useful wearable for heart rate variability. We can put on a cap to measure EEG activity, or we can do it from one single electrode. That's what we want to. And we can see what the relationship is like. And that's important because, again, the way the heart beats, it produces different signatures. And the signature has to do with emotion, and the emotion has to do with the behavior. So in trauma, there's a specific, there's some specific brainwave patterns, but there are also some specific heart rhythmicity patterns. The same applies for stress. The same applies for sleep. The same applies for depression. The same applies for pain. When we can identify this pattern and correlate the activity between the heart and the brain, then we can get the heart and the brain to talk to each other more efficiently. And we go from a disorganized individual to a coherent individual, an empowered individual. And the main point of communication between the heart and the brain is what? The vagus nerve. And the vagus nerve will innervate through the heart, from the heart, to the brain, different points. The thalamus, the amygdala, the insula, the frontal cortex. And if the heart is dysregulated, these areas of the brain will be dysregulated. We're going to see depression. We're going to see anxiety. We're going to see nightmares. We're going to see flashbacks. We're going to see anger and aggression, violence, and so on and so forth. But when we can regulate via the training this activity, then the brain will behave differently. And so, again, combining these interventions becomes way more powerful than working on them individually. And what are the goals of HRV? Well, one of them is we want to increase the difference between your heart rate, your maximum heart rate and your minimum heart rate. In essence, what we're doing here is teaching an individual deeper, slower breaths. At the end of the inhale, at the end of the inhale, your heart rate will accelerate and will reach a specific number of beats. And then as you exhale, your heart rate will decelerate. And what we look at is the difference between the inhaling and the exhale. The higher the difference, the better. Okay? It means a stronger heart, it means a stronger mind, it means more robust emotional management, more robust stress management, and so on and so forth. So that's one of the goals, to increase the difference through deep and slow breathing. Okay. And so what do we look for as well? The reduction of mental stress and health symptoms. How do we do it? Via the breath work. And this has physiological and biochemical consequences. There's a recent paper I was reading the other day in which now they have proof through MRI that heart rate variability can reduce the accumulation of proteins and plaques that are associated with neurodegeneration. So it can tame and it can help reduce the accumulation of tau protein in Alzheimer's and other cytokines and plaques that are associated with Alzheimer's, frontotemporal dementia, Lewy body dementia, Parkinson's disease. So if not for anything, we can do the breath work to prevent neurodegeneration in the future. Because we know that once the person meets the criteria for dementia or any other form of neurodegeneration, there's nothing we can do. But we can prevent and we can start ahead of time. And, people with trauma have very high degrees of neuroinflammation, which puts them at higher risk for neurodegenerative conditions. Heart rate variability is one of the many ways, one of the many tools we have in our arsenal to help with this. And we look for the synchronization between the breath and the heart rate. But we also look for the synchronization between the heart and the brain. First, we synchronize breath and heart rates. We teach them to breathe coherently, and the heart becomes very coherent and starts singing to this melody, and then the brain entrains to that. So we're entraining what happens in the brain and what happens in the heart. After doing that, neurofeedback can be even more effective for that. And so I want to, again, my point here is different emotions have different signatures. Okay, and those different heart signatures we can measure in the brain. With the technology available, we can do it, and we can do it with QEEG, EEG, and QEEG, or even 1 or 2 channel placements. Okay, the more channels we use, the more resolution we're going to have, and the more activity we're going to see to a degree, of course. And here's the example of that client. Again, here's the mu in the raw EEG. Here's the power for the mu in the brain map. And here in the blue box, you can see the mu as the client starts engaging in coherent breathing. I'd start teaching this client to do 6 breaths per minute for 5 minutes. And in 5 minutes, he was able to self-regulate very efficiently. That's very, very powerful. And we can now objectively demonstrate it because we can record both heart activity and brain activity simultaneously. This is an individual at baseline. This is the EEG and QEEG of an individual with high anxiety at baseline. This is an individual with trauma, and the main or most selling presentation for them was the hypervigilance. We can see that we have some high beta power that is not muscle tension related. We have very fast alpha waves, and we have some fast high amplitude low beta waves. So overall, this is a hypervigilant individual, and you can see the high amplitude in the raw EEG, and you can also see the interbeat intervals. With this system, you can record the EKG, and the EEG at the same time. Now, this individual has very high activity in the anterior cingulate cortex. So essentially, it's rumination, fretting, cognitive inflexibility, some touches of OCD, obsessive compulsive disorder. And this is the baseline. Now let's have them breathe and see what happens. So this is doing 7 breaths per minute.
Should I be seeing your slide now? I'm sorry. Should I be seeing your slide now, or
is it not showing?
I'm not seeing it.
Is everyone still seeing it, or is it just?
Yeah, I'm seeing it.
Oh, okay.
I'm going to stop the share and share again, see if that helps. Okay. How about now?
Yes.
Yes, thank you.
Okay, you're welcome. All right, so now we did the baseline, and I started testing different breathing rates. So it's sort of the resonant frequency training that you do, right, to help the client find their optimal breathing rate. And let's see how the brain responds. So this is 7 breaths per minute, and we did it for 5 minutes at each time because they could tolerate it, so both emotionally and physically. And as you can see, there's a reduction already in the amplitudes. If you see the baseline, look at the amplitude for the alpha waves and the high beta waves, 25 to 30 hertz. And you can see it in the raw EEG. And then after 5 minutes of 7 breaths per minute, look at the reduction in the anterior cingulate gyrus. There's still activity there, but this is way more manageable now. And if you can see, the alpha amplitude drops, which means better self-regulation. Now, this is anecdotal, of course, because this is just 5 minutes and we need repeated measures, but this is just to show how powerful an intervention, how heart rate variability is. And once you can stabilize this brain even further, well, the advantage is that as you get into the neurofeedback, this brain will understand more efficiently. This brain will be now more open to the neurofeedback. It will be ready to accept it, and then it can go into its own state and doing its thing, taking over when the neurofeedback is taking place, and be more absorbed in itself. Now we go down to 6.5 breaths per minute. So we slow it down half a breath, and we still see benefits from it. The reduction in the amplitude is even more noticeable now, and also the reduction in the activity of the anterior cingulate gyrus. The interbeat intervals now become longer, which is one of the objectives we want to achieve with this. And interestingly, at 6 breaths per minute, we notice an increase in the activity. So that the alpha peaks go up a little bit, and there's a slight increase in the activity here, which means that at least for this time, for this moment in time, we are going too slow for this individual. Now, they're breathing too slow, and they're experiencing the symptomatology again. At least that's what the EEG is showing at this moment in time. So that gives us an idea of the ideal breathing rate for this individual. Now, down the line, we could maybe slow down the breathing for this individual a little further, and the EEG will still show a positive response, and subjectively, they will give us a positive response. But the point here is that it helps us gauge what we can do. And again, the same we can do if we're using an amplifier with, we're doing monopolar training, bipolar training, two-channel training. We can exactly do the same thing, not with the same precision in the imaging, but it can give us some interesting patterns. And this is the Loretta images of the before and the after. So for this individual, T6, the typical alpha peak at T6 that shows that trauma response, post-breathing is not there anymore. And again, this is only 5 minutes of breathing. We need to do more repeated measures. The activity in the cuneus, precuneus area at Ptsd also becomes less active, and the same for the third view that we have here. So all in all, the point here is heart rate variability useful? Yes, it is. Can we measure what's happening in the brain in real time in a cost-efficient manner? Yes, we can. And this is good because people respond to data. Clients respond to the data, peak performers respond to the data, and they love seeing this in real time. So we can enhance the physical responding, we can enhance the emotional responding, we can enhance the physiological responding. So we can enhance help with medical conditions, we can help with emotional components, we can help with psychological components. And as a last but not least part of the presentation, I just want to talk briefly about what the neurofeedback is and what it does. Okay, it's not a neurofeedback course, of course, but we just need to see why neurofeedback is also important when it comes to trauma. So I hope everybody's seeing the slides. And with neurofeedback, again, what we're doing, we're training that brain to talk to itself, to self-regulate itself. It's the self-regulation that we can achieve. We have an individual with X, Y, and Z amount of symptoms, and they are experiencing these symptoms. We look at brain activity, see where it's dysregulated, and now we can train it. And basically, what we're doing is placing sensors on the scalp. This individual sees the brainwave activity, and they respond to it based on some feedback. That feedback is a video game. That feedback is a movie. That feedback is a song. That feedback is a teddy bear that vibrates in response to that brain. And so we're creating this conditioning where the brain learns to understand why things are not working for it, and the brain understands that it can self-regulate. Because many times when a client comes to see us, their brain doesn't know that it can self-regulate, or it's forgotten that it can that it has this self-regulation ability. And so that's what we do. We show the client the ability. In the first few sessions, the client is aware of what's going on, and they sometimes try to control what's going on. And then once the training takes over, the brain is doing the work. So it's like you're driving a taxi, and in the first few sessions, you're telling the taxi driver where to go. And then after a few sessions, you're sitting in the back and you're trusting that the taxi is going to take you where it's supposed to take you. The taxi driver is supposed to drive you where you told them they wanted to drive you. And we do it by, again, doing that feedback and controlling that. There's an interface between the client, the computer, the clinician, and also the amplifier that is used. The client will have some electrodes, they're looking at that activity, or they're listening to the activity via sounds or music, and they respond to it, and they work to regulate it. It's much like looking at yourself in the mirror before you lift in the morning. You put your makeup on, you brush your teeth, you shave. You need a mirror to have a point of reference. So neurofeedback provides this point of reference to the individual and to the brain as it pertains to that self-regulation. And neurofeedback can be useful for trauma, but it can also be useful for a myriad of other conditions: ADHD, epilepsy, sleep, for medication reduction or medication elimination. Now for neuroinflammation, for different degrees of neuroinflammation, glia priming, useful for addictions, useful for anxiety, useful for depression, peak performance. We've listened to many very famous athletes talk about their work with neurofeedback and how it's helped them optimize their performance. And sometimes the trauma response itself is not what affecting the individual, is the comorbid symptomatology that goes along with that. So an ADHD individual could experience trauma, and the ADHD could stem from the trauma. The addiction can stem from the trauma, and this is very common in U.S. war veterans. And the work that a lot of you are doing with it involves working with the addiction. And so athletes can get injured, and that's a form of trauma. And their performance can go down. Performance can go down because of that. So that's what we look at. Now, this again are some of the organizations that I've consulted or worked for. So it's also useful for peak performance. And all of these Olympic committees: the U.S. Olympic Committee, the Canadian Olympic Committee, the Colombian Olympic Committee, Sports Singapore here, they all use neurofeedback and biofeedback as part of the interventions, in addition to traditional sports psychology. And so we use an operant conditioning model in which we are rewarding a brainwave frequency, or we are inhibiting a brainwave frequency. And through doing that, we're teaching the brain to self-regulate. You know, we have a hyperactivated brain, a hyper-aroused brain. Well, we're going to inhibit certain frequencies so that you can learn to mitigate your anxiety and respond better in situations that would otherwise trigger that anxiety or a panic attack, and so on and so forth. And again, we can combine that with other forms of neuromodulation: photobiomodulation, audiovisual entrainment, transcranial direct current stimulation. But we can also use it in conjunction with modalities such as cognitive behavioral therapy, brain spotting, EMDR, DBT, you name it, because the technology is really not antagonistic. And I always think the more you can provide for somebody, the better. Now, to me, the main point here is that you cannot bring the change unless you bring the self-regulation first, and then you enhance the plasticity. So to me, neurofeedback is sort of the preemptive strike where you can help this brain modulate itself better. And that opens the possibility for change through the skill that it's learned or acquired through psychotherapy, through brain spotting, through EMDR, through coaching. But the problem is that the individual gets stuck and cannot progress, the progress plateaus, because there's no changing of the plasticity and the activity of the brain. So that's where we come in, and that's where our interventions are very powerful and quite useful. And so what we need to consider when we're working with clients with trauma or different things is we look at the data, right? We do an assessment, 2-channel assessment, QEEG 19-channel assessment. We look at the data, we understand the data, and we use that data to train the client. We need to understand the client. Where do they come from? What are their goals? Are those goals realistic? What are their symptoms? What are their chief concerns? Can we work with that client? Is that client ready, willing, and able to do neurofeedback or biofeedback, or both? We also take a look at other screenings like psychometric measurement. And I work hand in hand a lot with functional medicine practitioners. So I also take a deep look at the tests that functional medicine practitioners do, especially when it pertains to neuroinflammation. Looking at those chemical markers for inflammation, that also helps me guide the neurofeedback training. And obviously, another thing we can do is a psychophysiological stress test with biofeedback modalities. The more information they have, the better. And it's all aiming at providing that self-regulation and that healing response, right? Now, in the traditional amplitude neurofeedback mode, we look at biomarkers. So we look for specific brainwave patterns that can be present, and we call them phenotypes, and meaning there's specific brainwave signatures to trauma, but sometimes individuals with trauma don't have these biomarkers. So we understand from the EEG perspective how the trauma is disrupting optimal and healthy brain behavior. And then we seek to change that through the different combination of the different modalities. So that's one way of doing it. And again, we look at that's different displays from different equipment and as to how the data is presented. The important thing here is, as an individual, you should educate yourself, learn and train yourself to understand the data, understand what it means, so that you can more efficiently do this training. Okay, and you should work with a supervisor or a mentor that can give you with experience, who can guide you into this process. So one of the ways of doing it is Qeeg-Guided neurofeedback, and as we saw already, we can use a 19-channel or more channels with a cap, or with dry electrodes or a wet cap to guide the intervention partly. Now, a lot of people use QEEG, some people don't. The important thing is that it's to understand that QEEG is just part of the tools. It's not the one tool you're going to use. You shouldn't rely 100% on it, but you can use it as a guidance to that. And the important thing here is that people need to understand when they're looking at the EEG, they need to understand what they're looking at. So I'm going to close with this slide here, because I know we're running out of time. A very common thing that happens is that individuals will mistake epileptiform discharges, like the one you see on the right, or epileptogenic activity, with eye blinks. And I've consulted with individuals who take out epileptogenic or epileptiform discharges because they think they're eye blinks. So when we're looking at the data, it's very important to discern friend from foe. What is real in the EEG? What corresponds to real brainwave activity? And what corresponds to noise in that signal, coming from an eye blink or movement or a faulty cap? That's very, very important. So that will bring me to, for those of you who are interested, we have some training dates coming up. This is another training dates that's close to them. We're going to have a series in biofeedback, in neurofeedback, and in QEEG as well, that I'm going to be teaching in San Antonio, Texas. But if you're interested, I suggest that you contact Kelly Feely. There's his email address, kelly@successfulpractitioner.com. You can schedule a 25 free-minute consultation with him. And if you're interested in any of the training programs and any of the modalities, he will be happy to help you provide that info. And if you go to successful-practitioner.com, you can learn more about the upcoming training dates for the neurofeedback course, the QEEG course that leads to QEEG certification. And I also teach an advanced EEG class, which is EEG interpretation, and also an advanced EEG class with report writing. So all of these give you CEUs for your certification or recertification, for your APA, and whatever else you need. I want to thank again NRBS, Mitch and Angelica and Sol for the opportunity to present on this. And now if there's any questions, I'd be happy to answer them.
Thank you very, very much for that chock full presentation. I appreciate that a lot. I did see one question in the chat up to now, and there's a person that, asked if you would elaborate on the frequency and tone main components of the HRV, the lower frequency to higher frequency ratio, and the very low frequency.
Okay. I will try to be quite succinct, and I'll type my email in my social media on the chat. So if people have more questions, because of time I cannot respond, they can email me or contact me to my social media. Just give me 1 second, please. And I'd be happy to respond more profoundly that way, more in depth. But basically, you have the very low frequency component, the low frequency component, and the high frequency component. And those are indicators of where your sympathetic or parasympathetic nervous system lies. So that's your autonomic nervous system, gives you an idea where you are. And the very low frequency domain, it's indicative of sympathetic arousal or sympathetic activation, sympathetic activity. The high frequency, on the other end, is indicative of parasympathetic dominance or parasympathetic activity. And the low frequency is indicative of what we call autonomic balance. And when you're doing heart rate variability, at baseline, you want people to be dominant in the high frequency domain, which is more of a parasympathetic response. So that's where you want the highest activity to be. When you are training, when people are engaged in heart rate variability, coherent breathing, deep coherent breathing, you want them to fluctuate towards the low frequency, which is the autonomic balance. So it's a state of well-being. People call it relaxation. People call it bliss. People call it peace of mind. But in reality, what we're achieving is self-regulation. As clinicians, our goal is to obtain and attain that self-regulation, which the client will translate into words like peace of mind, relaxation, mindful state. And so that's what the domains give you information about. But again, I would ask the person asking the question to please send me an email, and then I'll be happy to go in depth.
Okay, thank you. Another person asked if you would have any recommendations for equipment for either biofeedback or for collecting EEG for Qeeg analysis.
What I would suggest that person is that they send Kelly an email. And then let me write his email here. For that recommendation, I don't know if I'm allowed to say what I use or not. I can tell you what I use for my practice. Wet cap, I use Mitsar. Dry system, I have the iMedisync from Korea. And then for biofeedback and neurofeedback, I have used Nexus and Thought Technology. That's what I use. That's not necessarily what I would recommend. And because as an instructor, I need to remain, and I want to remain as neutral as possible, it's better than they contact Kelly, and Kelly can give them more information about that, because he's the person who specializes in providing all this help. However, if somebody's interested in talking to me more privately, I'll be happy to guide them again via email, and we can have a more private conversation based on their needs as well.
All right, and then we have a person who asks, how often do you encounter the Bohr effect, B-O-H-R, when working with people and slowing their breathing patterns?
I'm not familiar with what the Bohr effect is. If they can explain it to me, please. I don't know if they can type it on the chat, or again, they can email me.
Yeah, I mean, the Bohr effect is about the oxygenation of the blood and what occurs. But yeah, I think if Spike could elaborate a little bit. Spike, yes. What What is?
Well, the Bohr effect's a compensatory mechanism set up with the kidneys and hemoglobin, so that when the pH of the blood, if somebody has been doing shallow upper breath, upper torso breathing for an extended period of time, they're blowing off too much carbon dioxide, and they're changing the pH of their blood. And so the Bohr effect steps in to mitigate that. And the problem is when we start teaching people to do diaphragmatic breathing, they're flooding their system with oxygen and further distorting the ratio of CO2 to O2. And so it can cause people to become anxious, angry, they start coughing, they get dizzy, all sorts of different reactions. And so it's a difficult transition. I see it a lot especially with older clients who have been anxious for an extended period of time.
Yeah, thank you. Yeah, I've noticed that quite a few times. Not as many as you may, but I had that happen to me before. And something that I do with those individuals is that I normally start teaching them shorter inhale and shorter exhale, and not go deep into expanding the inhale to exhale cycle until they can adapt the body to doing it without having a negative reaction to it. And I don't know if you use a capnometer, but using a capnometer would help with that, because it can give you a more profound idea on how much CO2 they're expelling when they're exhaling. But what's helped me in that case is that I use shorter inhale and exhale period of time. I train them for a few sessions, they adapt to it, and then we gradually increase. And in my experience, that's what's done the trick.
Okay, thank you very much. I think we are at our time limit here, and I don't see any other questions. So I think I'm going to say thank you on behalf of NRBS and all of the listeners. That was very informative. We appreciate it, and I wish everybody good night, depending where you are, of course, and thanks again for attending. And please, if you aren't a member of NRBS, please think about joining us. All right, everybody. Thank you.
Thanks. Have a good night, everybody. Thanks for coming.